Hello, I'm your host, Dr. Sonia Johnson. Waiting on some people to join us. And I'm sorry we're starting late. Just been a busy day today. Today is Friday. So excited. We were very busy in the office today. So I do procedures, surgical procedures on Fridays. And we just had a lot of interesting cases. So I love what I do. It's really fun. You just walk in and get to do some surgery. So I like that. Anyways, if you want to just share the screen, just press the button at the bottom of the screen. Sharing is caring. And if you have a friend that you want to hear this message, just tag them. Today we're going to talk about a continuation of what we've been talking about in the past. So, welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today we're going to talk about what happens when you have adverse reactions to the dermal fillers. As you mentioned, I talked about dermal fillers, which includes the Restylane, Radius, Juvederm, Sculptra, and Voluma by the Juvederm, part of the Juvederm family. But there are so many other fillers. And the beauty of, like I stated, the fillers that we deal with now, they actually mimic ingredients or products that are normally found in our body. So hyaluronic acid is a natural product that we create, and now a lot of our fillers are made with hyaluronic acid, but to make them thicker and a higher or larger molecular weight substance that'll last longer in the skin, when they're injected, they cross-link them. We have other products that have lactic acid as well as hydroxyapatite, which is your Radius. So we have a lot of neat fillers out there on the market that really do a wonderful job. So the question is, when you have a adverse reaction to one, what do you do? So a common reaction would be if you use a filler that is too large molecular weight in areas that are very thin skin, such as your lower eyelids, of course, your lips. And another thing is using fillers where you have a lot more movement. And so when you have a filler, when you have an area that is a lot of movement, like your lips, you want to use a light or low molecular weight injectable. You don't want to use a very thick filler that lasts a year to 2 years, because they tend to change a little bit. So for, like I stated, areas that are thin skin or a lot of movement, you want to use a lower molecular weight filler. But if you use a thicker filler, you may end up with a lot of lumpiness, or you may end up with, on the lips especially, beading. The fillers actually sort of break apart and starts making these what we call granulomas or beads in the lip, the borders of the lip, wherever you're injected of the lip. And the only way to get rid of that is to cut it out. Or the doctor can try injecting them with steroid or prednisone, and that may not be a good idea because it can cause other adverse reactions. So you just want to be really careful when you get these fillers injected. You go to someone who is a pro. They've been doing this for a while, not something they just started, and they know about different fillers and which fillers are good for certain parts of the face, or even on the hands, or wherever you inject these, you're going to have your fillers injected. Another common problem is placement of the filler in the wrong location, meaning, so if the filler should be intradermal, they either inject it too deep or too superficial. And if it's too superficial, it can cause a different appearance on the skin. And the only way to take care of that when it's injected in the wrong location of the skin, sometimes you have to let it break down on its own over time, which, depending on the filler, it can happen over 3 months to 2 years. So, or you may have to lance it and remove that filler out of that area if it's going to cause other problems. So, for instance, you can inject the marionette lines, okay? And the filler is injected too deep underneath the dermis, and sure enough, you can feel it on the inside of your mouth, which you should not do. So again, if it becomes a problem where that area is getting caught between the teeth, then yes, you may have to have that filler area lands and that filler removed. Otherwise, if you can deal with that, you just tolerate it until the filler is absorbed naturally, which takes time. It's rare that you hear about reactions to a filler, such as a person having a contact reaction or a hypersensitivity reaction. But if they do, a lot of times it's most likely not the active ingredient, but the inactive ingredient. So again, if you tend to be very sensitive to things, or you're allergic to certain products, you want to make sure you inform the person who's going to inject the filler what your allergies are, so then they can make sure that the ingredients that are in the filler, the inactive products, won't pose a problem for you. So those are your common problems that may occur with fillers. Any questions for me? Okay. Well, thank you for joining me. And if you have any other questions, by all means, put them in the comments section. So if you are really against injectables, there's a product out called the Wrinkle Free Serum that you apply on the areas that you want to increase the collagen in that space, like I said, the nasolabial folds, your cheek area. And this product is amino acids, and it helps your body to make protein and collagen. So again, you can go to yes.gorgeousskinnow.com. And you can get your free gifts, as well as you can buy this product, which is Wrinkle Free Serum. Otherwise, thank you again for joining me, and thanking everyone for listening in. And I will see you later. Have a wonderful evening. Again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. And I'll see you tomorrow. Take care.